Thanks for staying with us. So, moving on to other matters, especially it's Tuesday, so we're talking about health cases. COVID-19 cases are on the increase, raising fears that the country is on the verge of maybe a fourth wave of coronavirus. According to reports, the Nigeria Center for Disease Control, NCDC, showed that the 28th of November to the 4th of December, a total of 585 cases were reported. Joining us on the show is the infectious disease physician and head infectious disease unit, Department of Medicine, University of Lagos, University Teaching Hospital, Luth, Dr. Iorhen Akase. Good morning, Dr. Iorhen.
Good morning. Good morning.
Welcome to the show, sir.
Thank you.
So, COVID-19 cases, we have sort of relaxed in our adherence to the COVID-19 guidelines as not just a state, as a country at large. But the government have consistently tried to remind Nigerians to maintain social distances and wear the face mask. Could you give us an update on where we are concerning the number of cases that are reported that we have as of today?
Okay, so consistently, we've seen over the past few days increased number of cases that have been reported officially. Also yesterday, 2 days ago, the numbers were more than 500, 600. I've not checked today's figures. But what we're seeing on ground, really, is that those figures markedly underestimate the number of people that are having symptoms. We're seeing lots and lots of people having symptoms which are mild, and are not necessarily coming to hospital to be checked. But now with the knowledge, people are taking medications and doing all of that and staying at home. So it's really something that we've seen in terms of clinically, but also in terms of reported cases. But clearly, the reported cases markedly underestimate what's on ground. Fortunately, there are mild cases generally. People are just having febrile illnesses, treating malaria or some other thing, and and getting better. And the real concern among people who work in infectious disease is that this is we hope that it stays like this. Waves usually start in this manner. You see people usually it's mild, increased number of uptick in number of cases, people having symptoms, but generally mild. Until it breaks into the community full scale and starts picking up on the vulnerable people. So it's cause for concern, to be honest, and I'm happy that the government, at least of Lagos State, is addressing this as such. Yeah.
Okay, so Dr. Akase, I have to ask, these large numbers that we're looking at, is this a new variant? When we see these large numbers, are we testing them to find out if it's the new Omicron variant? And these symptoms that you have spoken about, there's so many people, almost daily, we see these people with sore throat, body pain, headaches. But people have gone and done tests, and it says it is not the virus. So is there maybe flu season, Harmattan season, intermingled with this COVID? What's happening?
Yeah, so those are very valid, questions and observations you raised. So to start off with the testing, we all know that countries bring up testing policies based on what they're able to do. For example, elsewhere, people who are exposed to other people with COVID, not even symptomatic, exposed to other people are supposed to be doing daily testing to see as of when, because one-off tests usually hardly ever tells you, the truth of the matter. Viral infections are picked up at the point, when people do tests, it's like a snapshot of that particular point in time you are seeing the person. And so many factors affect whether results come out positive or not. Depends on how much virus are being shared at that point. It depends on the technique that the sample was taken. So many factors depend on what the viral load was at that point in time. So one single off testing, have their own shortcomings, which is clear enough. Secondly, with new variants, older kids are sort of giving us, unpredictable results here and there. We're saying that, with repeat testing, with different, modalities, we're now picking up that. Having said that, you like rightly said, the weather has changed a little bit. So with or without COVID, this is a time where we'll have other forms of, respiratory tract infections, which are also viral in nature. So the symptoms at the beginning will still be the same, more or less, some sore throat, stuffy nose, febrile illnesses, joint aches here and there.
Yeah.
So all of those cannot be ruled out. However, to be honest with you, our capacity, the country's capacity to test each and to sequence each and every sample taken to know what type of virus this is, and if it's COVID, what variant this is lacking at the moment, to be honest. Now, I think most labs are just doing PCR, and at most, they are banking the samples. Over time, I'm sure they will be tested to know, okay, what was it, Delta, was it COVID, was it, Omicron and all that. But to be honest, I don't think all our labs are sequencing all the COVID variants to know what type of variant, we're dealing with. So as a country, I don't think anybody can give you that kind of data, at the moment, yeah.
It's really sad. It's really, really sad. Is it a lack of funding, though? Because I know that a lot of, Nigeria has gotten a lot of support, donations to help improve testing capacity and all of that. Because we're currently being touted like a red list country, like this thing might have originated from us, or maybe we mutated here, but we cannot tell. Based on your own knowledge of what is going on, do you believe that any research is going on from our own end as a country to tell if it started from us? Do we have the capacity to do it?
I think I've already answered that, but go ahead.
Well, so the truth of the matter is that, as a country, at the beginning, you mentioned the attitudes we all have had towards COVID. It's not just from the general population. It's from government, from funding agencies. Everybody just wishes COVID had gone, goes away. Nobody is willing to do the hard work. To be honest, investment, our healthcare system has always been weak, to be honest. And, COVID did strengthen some areas, but it's always been an attitude of when the pressure is up, people jump up and say, okay, what can we do? Where can we throw in a few investments here and there? But to be honest, research funding, 2 weeks ago, when in a conference with people in the Nigerian Institute of Medical Research, this is supposed to be apex research body as far as government is concerned. Their funding is miserable. They can't do anything in terms of, they're running helter-skelter trying to get funding. Research is expensive. Logistic-wise, getting capacity, building capacity. Unfortunately, like we've seen with many other aspects of our life, public, aspects, those structures have been very, very neglected, and now we're seeing the effect of that. To be honest with you, most of the research output we've seen from scientists in the country have either come from personal, funds, that, or of course now we know TED Fund has come on board, trying to, cut up gaps. But infrastructure that has been there for so long is going to take a while. So, and this is why, I'm a scientist I work with. I must commend Nigerian scientists for working with their fingernails to try and bring an output. But to be honest, the challenge we face now, and the things where everybody just wishes COVID goes away. Anytime COVID comes up, I've had people accuse me personally that is because, I'm an infectious disease physician. It's not as if I got involved because of COVID. But people accused me and said, oh, you people that are doing COVID, you don't want COVID to go away. As if, so there's that attitude from everybody that this COVID thing,
let me go on a break, Dr. Akase.
COVID don't go away by getting tired.
Let me go on a break. When we come back, we'll continue this conversation with you. Stay with us, we'll be right back.
Stay tuned. Your View will be right back.
We're still discussing COVID-19, and we still have Dr. Akase here with us. Mikey, you had a question before the break.
Yes. Nigerians, we have this belief that the coronavirus is not that bad here. And if we just treat malaria, we're fine. A lot of people don't believe in taking the vaccine. And we just some people feel that it's the sun. Some people feel that it's the malaria that is in our blood. Other people feel it's the pepper that we eat. Please, can you dispel or confirm these thoughts?
Dr. Akase, I would like to add to that, because that was going to be part of my question. Dr. Akase, I'd like to ask you also that the truth is we all go to parties in this country. We enter with face mask. As we enter like this, we put the face mask, we put it down. We have the party, and we go home, and we're all right. All of us, we go to big parties, small parties, get-togethers, pool parties, playing, we do everything. and we seem to be living our normal lives. Yes, there's a 0.0000% that might catch COVID, but because the majority of us don't catch COVID, we always feel, just like YK said, that maybe it's our son, maybe it is something. So in the last 1 year that this COVID has been with us, what research have you done, as Nigeria or Africa done, to confirm or to refute the claim that it is not really prevalent in Africa, like it is in other parts of the world?
Okay, yeah, thank you very much. I mean, this is a question that has been asked repeatedly, and it's something of many researches. And unfortunately, up till now, nobody has come with consensus despite that. However, some of the contributing factors she's mentioned, they has to do with, one, we have a young population of people who, not that we're not getting infected, but people are getting infected, having symptomatic infections and recovering because we're primarily a young, population group. Secondly, again, the weather contributes. We all know that COVID, viral infections generally prefer cold weathers that have low humidity. In our tropical, environment with high humidity, it's not too conducive for viral infections. So the truth is, definitely Africa has not borne the brunt of this infection as as expected. But there are two major downsides to that. The first one is the fact that because of that perception, especially among the younger population, because they're the ones that are up and about. If you look at the absolute numbers, it's not that much. But if you look at those that eventually succumb to this infection, because their general attitude has been, oh, it's nothing. But somehow out of 1,000, you get 10, 20. Those 10, 20 to those families is real and it's significant. They lose people and they know what they go through in terms of, some people have financially been wrecked by COVID. If you look at those that require ICU care, the medications, it's been wrecking economically. So this is one downside to those families that have lost people. To them, it's real. They don't know whether they're Africa or not Africa. Right. They lost someone. They've gone through a traumatic experience. Secondly, the risk of mutations. Mutations happen in people who have infections and transfer it to others, whether they're symptomatic or not. So the major drivers, and this is where sort of there's some, I won't justify the decision by some of the West to just blanket, ban people. But we all know that the cooking pot of mutations are those people who are not having symptoms, getting infections, just the virus just having a free day, getting mutations and churning out mutations in the group. So there's an argument that, and this is just an argument, that Africa, even though we have not had symptomatic infections, but a lot of mutations have come out from Africa in terms of, we being fit and able to allow the virus to do all the experiments, more or less, that they want in the human body to bring. And you know that mutations simply come up when viruses just want to find a way of surviving, and they, somehow that's that.
No,
okay, let me take this call. Let me take this call. Let me take this call, then I'll come to you. Kayode, are you there? Hello, Kayode.
Good morning.
Good morning, you're live.
Ladies.
Good morning.
Yes, thank you for that question you've just asked the on the Zoom. Yes, you just asked the doctor. Now, before that, I just wanted to encourage Software and Marian to applaud the government on the reaction reciprocity policy concerning UK, because the same development, as you read out in the newspaper, that UK government have been the development that they're going to strike it. And I think it was as a result of our reciprocity movement by the government. Now to the doctor, Morayo. Ladies, please, Nigeria is a COVID-free state. There is so much going on that they didn't want that Nigeria is a target. And it's because Nigeria was just blessed. There's so much reason that Nigeria is a target. Yes, Miriam, yes, you can laugh, but I'm telling you, every of these things was imported into Nigeria. Ebola was imported into Nigeria.
I agree.
Okay, malaria was imported into Nigeria.
I agree.
And then so many other diseases as well. And God has revealed the way Ebola came in and this COVID came into Nigeria. Just like that doctor said, there is no consensus. It's not that, it means that there is one of the doctors disagree that Africa has disappointed the world. and Nigeria has defeated all predictions. Let me tell you something. If malaria is in Nigeria and malaria is not in London, and Russia cannot have malaria, and malaria is the SARS agent, malaria is the SARS agent. How come they don't have malaria in UK and they don't have it in Canada and they don't have it in Russia? So it means there's a factor. It means this COVID itself has its own special character. So whether they like it or not, it's not an African thing. They are making a lot of effort to stigmatize Africa. And in Africa, we always say Nigeria is the mother of Africa. We are a target. We are the elephant
Thank you.
in the room.
Thank you very much,
Kayode.
Kayode. I like our doctor to respond to that, because Kayode's views be saying that this is obviously some kind of a conspiracy theory against Africa. And what are your thoughts on this? What do you think? What do you make of what he just said? What Kayode just said?
Okay, well, I mean, I really appreciate his candor and I don't understand with him that really some of the attitudes that some of our international bodies have gone on about, the way they have exhibited, have fueled some of these conspiracy theories. Unfortunately, when you have a pandemic, pandemics are a very good breeding ground for conspiracies, especially when there's so much uncertainty around this, and around that. So I'm a scientist, I'm a clinician, so I tend to make judgment based on what I see. Of course, he made something around malaria, why malaria is in Africa, not elsewhere, and again, which there are clear scientific theories to explain why that is so. Malaria parasites cannot, survive well outside a particular temperature. So they survive well in mosquitoes here in the country. Elsewhere, they don't. So these are all things. But his sentiment clearly shows us how much work we need to do in terms of both getting everyone on board, because everybody does have a role to play. And if you have a section of our society that feels disenfranchised or has issues around the approach or some of the things, then we do know we have a big problem on our hands. And I think as a country, in terms of putting in structures in place to protect our people,
right?
It's always good for us to get scientific basis around what we need to do. Okay. Around that. So
right,
I understand what you're saying, but I may not agree with him entirely.
Let me get the final question in for you. Go ahead, Waike.
A lot of us Nigerians are anti-vaxxers. What would you say to convince us to become vaccine conscious or to take the vaccine? Or do you think we need the vaccine?
It takes a minute.
That's a big question. I mean, I have colleagues. Well, I mean, that's a big question. I have colleagues, doctors and nurses, who are vaccine, hesitant, or who are vaccine, pessimists. From all the evidence shows us. I'm not here to talk about the origins or who brought what and all of that. At the moment where we are right now, we've seen how, COVID, this particular variant, is able to spread through a population so easily. We've seen how the masking and hand hygiene and all of that is not proven to be so effective against this. For now, it will seem that our easiest and most effective way out of ending this repeated. I mean, we all have seen how much disruption COVID brings, and I've seen irritation. Unfortunately, for now, it will seem vaccination seems to be a way out of out of this. For now, that is how it seems. And you all know that COVID came. And knowledge is on an evolving base. Nobody can claim to know everything about COVID and tell you what's going to happen in the next 1 year or so. So we're dealing with data as it comes out. Now we know that vaccines are just the way to go, to be honest. And whether we like it or not, it makes economic sense. It makes logistics sense. It makes sense in every way possible for everyone to get vaccinated. Because if you don't, we're just going to keep getting these cycles and over and disruptions. Now countries are going to get locked down again, so that's elsewhere, not Nigeria. So really, there's no running away from this.
Thank you very much, Dr. Akase, for joining us this morning to shed more light on this. We'll continue to monitor the COVID cases, especially with this new Omicron variant, and ensure that Nigerians do what it is to keep safe. Thank you very much for joining us this morning on the show, Dr. Akase.
Thank you.
There you have it. COVID. But yeah, we know it's real, but I guess we just need data. We need more data from this end.
how much data do you need?
Not from abroad, though.
No,
local
I
data.
know, to stop you from your party moves.
No, I don't go to parties.
Her parties.
I don't go to parties.
Mariah, please.
Let me tell you the truth. Me, I will not stop party.
Yeah.
That's my own truth.
But you've gotten vaccinated.
That's not the problem.
Yes, we've gotten vaccinated
I
now.
don't believe the vaccine is going to stop me from catching it if I'm going to catch it.
But
I wear my mask and I go and party, man.
Yeah,
Me too,
I've seen you at those parties, and I've seen the mask go from one side to the other.
Let me tell you something. I will die of loneliness if I sit down in my house than if I go and enjoy my life.
But you see, are we all just hypocrites? Because we go to a party and enclosed with air conditioner, with our face masks, thinking that we're all protected. No, we're not. We're all breathing the same air.
I think that we should, whether you believe there's COVID or there's no COVID, just get vaccinated. Just
Yeah, so it's only vaccinated. Well, those that are vaccinated, some of them are still catching COVID. But the point is that once you enter an enclosed room and the air conditioner is on, we're rotating the same air. So if you have your face mask, put everything, we're all still blowing the same air. So if somebody coughs COVID into the air, we're all breathing it. I think it's the only God that is helping us in this country. I didn't want to say that on this thing, but you know, I don't know. But
let me just
scientifically,
Dr. thinks I'm not. I don't believe. Yes, I've taken the vaccine, but that's because I need to go and see my child. And they won't let me enter if I don't take the vaccine. So I've taken it. It didn't make any difference to my life. I didn't feel any strange. I was not ill. So I don't think it's a bad thing. I don't think it's a bad thing to do.
If you go to Lagos markets, if you go to Balogun, if you go to, if you walk around this Lagos, you think, is there COVID in this country?
It's just weird.
I don't understand. So, but anyway, let us, I don't know if we're going to get...
I don't think it is fair. See them, they say they are banned us because of Omicron. Omicron, it's them that are dying.
We are here.
Omicron, they are far in the hospital now. We are still wondering about the place.